Welcome everyone to our third annual Stanford Medicine Rambam Healthcare Campus Symposium. This year's symposium is titled Disaster Preparedness and Lessons Learned from the First Wave of COVID-19. This is day 2 of 3, and today we will have even more great discussions in store for you. Today's theme is day-to-day management, and over the next few hours, we will be discussing surge capacity, virtual care, mental health, and frontline worker safety. Our symposium is taking place live through a one-way broadcast. This means that you will only be able to hear and see the presenters, and no audience videos or audio will be seen or heard. We welcome audience participation through the chat function. In the upper right-hand corner of your screen, you will see a chat bubble. Click that chat bubble icon to view the chat and enter any questions you have for our presenters. We will do our best to take as many questions from the audience as we can. The entire event will be recorded and available for viewing on our website in the coming weeks. To view the full agenda and speaker bios, please refer to our website. The link can be found below as well as in the chat. CME credit is being offered for live attendees. For instructions on how to claim the credits, please go to our symposium website. The link can be found below as well and in the chat. Without further ado, let's begin. I'd like to introduce Professor Rafael Beyar. He is the Professor Emeritus of Medicine and Biomedical Engineering at the Technion Israeli Institute of Technology and the President of International Friends Association for Rambam Healthcare Campus. Dr. Beyar.
Thank you very much for the introduction. I'll start my screen. It's really my great honor and pleasure to open this day 2 of the symposium. And as you mentioned, it's day 2, and we are talking about 4 major topics in this disaster, the preparedness overall view. For those of you who have not been to Rambam and who have not seen it yesterday, this is our campus over at Rambam. And you can see it's a major medical center with the Faculty of Medicine of the Technion next to it, with a health discovery tower in building for research within the campus, and with strong association with the academia, Technion, Haifa University, and with the industry, MindUp and other industry, not necessarily medical, next to us. And this has a lot to meaning to what we do. We are really honored that in these days, actually, the Rambam startup collaboration also started with the biodesign methodology, and this also has implications with respect to COVID, but you're all well aware of the biodesign, and it's already taking place now. And also, one thing which is very important is, in addition to the academia-industry relationship, to have a fund and a multiple of funds, like we see here, to allow for growth of companies over time for those who start from the patient bed and for the unmet need. Here for yesterday, I think you heard a great talks, and I can share with you some of them. Just as a hint, Dr. Halbertal presented to us the collaboration that was done with the industry and with the academia to create new quick solutions for COVID in the field of data management and taking data signals from sound in the field of protection that we will talk today also later on, and in the field of communication, which also is the topic of today. And if you, for those of you who haven't seen yesterday's presentation, this is the COVID preparedness for Rambam at Rambam. The control center is above ground. You can see it here. And the underground facility has all the departments with the patients there, and the protected staff are all together. And obviously communication between the system is key to the success of this major operation. Another very important thing that we have touched yesterday with Dr. Oren Caspi is data management, regional and global, and you can see here US and Israel, with the regional development. Really, big data science is a major, powerful tool to control COVID and to control what we see also as patients. And we know that politics usually messes big data completely, as we see it regularly in Israel, I'm sure over other countries as well. this is my final slide, just to show you that with all of this dealing with academia and with the epidemic, and we see here a group of visitors to the underground hospitals. Not all are doctors, some are just visitors. Important thing, everybody is interested in that, but the important thing that we remember that the patient is at the center of our activities. And with that, I wish us all a very interesting day for our friends from Stanford and the US, and for everybody from Israel and the other part of the world, good morning and excellent symposium. Thank you very much.